When a lady is pregnant, they are more at risk to get a urinary tract infection.
Hello everyone, this is Tracy Matanzima, your health coach, and today I'm glad to bring to you a doctor from Kabarak University, actually one of the senior doctors, and we have a topic to discuss. We're going to discuss urinary tract infection. So Dr. Msungu, can you please tell us a brief introduction of who you are? I just know you as Dr. Msungu. I don't know anything more.
Okay, thank you, Tracy. As you have mentioned, my name is Dr. Musungu Eugene. I'm a senior medical officer working here at Kabarak University. Anything else extra I've done health economics and policy, a master's program from the University of Nairobi, and I'm currently undertaking a master's in family medicine from the University of Edinburgh in the UK.
Wow.
So I think extra, other than my work, I'm a family person, I'm married, and I have 2 children. Yes, and I've been around for 10 years at Kabarak University.
Okay, thank you for that. So let us go back to the main topic of today, UTI, commonly known as urinary tract infection. So I want you to tell us what is urinary tract infection and what are the common symptoms in both female and male.
Thank you, Tracy. Urinary tract infections are basically infections that occur within the urinary tract. A tract is like a pathway, and the tract would be all the way from where there's production of urine in the kidneys, then coming down to the place where urine is temporarily stored. That's the urinary bladder before voiding. And the urinary bladder stores urine for some time. And when you feel the urge, then the urine will pass through the urethra to the external environment. That's the toilet, hopefully. I know some people also wet their beds, but the toilet. So any infection that occurs within the pathway, that's the bladder and the ureters, and the kidneys at the top, and the ureters and the bladder together with the urethra, that's what we call a urinary tract infection. And did you ask what are the causes?
Common symptoms.
Common symptoms, yes. So the common symptoms that would be for somebody who has a urinary tract infection would be the urge to pass urine more frequently. We call that frequency. And also there's pain when passing urine. So the urge to pass urine more frequently, and then there's pain when you pass urine. There's also what we call urgency. When you feel the urge to pass urine, before you get to the bathroom, the urine is already coming out. So that's what we call urgency. And because of the fact that the infection can occur in the kidneys and also at the bladder, you're likely to feel pain on your abdomen. So either the back, the flank areas, or the lower part of the abdomen where the bladder sits. So you can feel the lower abdominal pain. You can get to feel pain when you pass urine. You can get to be passing urine more frequently. And then you can have the urgency. You want to pass, you feel like the urge to pass urine, and before you get there, the urine is already out. Over and beyond that, you are able to feel a fever, like because it's an infection in the system of the body. So you can have a fever. You can feel weaknesses of the body. You can also feel like vomiting. So other symptoms that might more or less border to symptoms resembling other diseases like typhoid or malaria could also be symptoms relating to a urinary tract infection.
Okay, thank you. And so what are the causes of urinary tract infection, and who is at more risk of getting it?
Causes of urinary tract infections, which we commonly abbreviate as a UTI, are largely bacteria. Most of the cases are caused by bacteria. There's a common stubborn bacteria known as Escherichia coli or E. coli in most of the urinary tract infections. That will be the causative organism. But we still have other clusters of bacteria, Enterococci species. We also have Klebsiella species. We have Staphylococcus aureus species, Streptococci pyogenes. So those are just clusters of bacteria, but the commonest of all will be the E. coli. There could also be infections within the urinary tract that can be caused by fungal infection like Candida species, but in most cases, it's because of bacteria. And who is then at risk more? This bacteria spreads out from the external environment into the internal environment. So looking at the surrounding area where the urethra is, for the female clients, their urethra is shorter than the male clients, because the male clients have a penis through which the urethra passes inside, so it's a bit longer. So women are more at risk than men. That's the first category. And this infection is because it's coming from the external environment to internal environment. If you would look at other situations that can also be there, like for instance, when somebody has immunity challenges, maybe they have chronic diseases, so their immunity is compromised. So they are likely to get more infections than others. So people who have like chronic conditions like diabetes or other chronic conditions like HIV and AIDS are more likely at risk. And also, there are some situations that happen physiologically, like when a lady is pregnant, they are more at risk to get a urinary tract infection than those who are not pregnant.
Okay, and so what are the primary treatments for UTIs, and how does it affect you when you take too long without treating it?
Okay, thank you. So the primary treatment, of course, begins by the preventive approaches. The other bit that I just need to add on to my explanation is in terms of considering who are more at risk in terms of people and also factors affecting what we call behaviors. So some of the behaviors that can predispose you to getting more of UTIs would be if you have wrong or improper toilet hygiene practices. For example, we ask that if you keep wiping yourself when you've gone to the washroom from back to front, you are bringing the bacteria there's more bacteria in the body and also on the skin of the body. So you're bringing the bacteria from behind, from the rectal area to the front part where you have the urethra. So we advocate that you wipe yourself from front to back. Number two, if you use dirty toilets, then you are more predisposed. The other thing that also happens when you engage in sex too frequently with different people, because of the skin contact, there's exchange of bacteria between the partners. So that itself can predispose you to UTIs. So what we consider as then what you can use as treatment approaches is preventive practices. So maintain good toilet hygiene, use clean toilets, maintain good sexual practices also. And also, if you have chronic conditions, ensure that you're well taking care of your conditions. If you have diabetes, be able to manage your sugars properly so that you reduce the chances of getting a UTI. Over and above that, then we come to the treatment approaches that require you to take medication. So you'll be given antibiotics after you present to the doctor with symptoms suggestive of a UTI. The basic thing that will be done is a urine test. So your urine will be taken to the lab, it's tested. So when it indicates that you have bacterial particles in the urine or pus cells in the urine, you'll be given an antibiotic. In most cases, the antibiotics that you're given would be oral between 5 to 7 days. So that's what we consider. And especially if the infection is lower in the bladder. If the infection gets into the upper parts of the urinary tract, that's the kidney, your duration of treatment is likely to go longer for 14 days because you want to really prevent the kidneys from getting further damage. So that's how we treat urinary tract infections. And there are different antibiotics available, and the antibiotics that you'll be given will be dependent on several factors that work with an individual. The antibiotics which are safe when somebody is pregnant, and there are not others which are not safe when somebody is pregnant. There are antibiotics categories which are safer for given age groups also. And also now depending on you as an individual, whether you have allergic patterns to any of those antibiotics.
Okay, so you have talked about age groups. Does it mean even a small baby can get UTI?
Yes, they can. Even small children can get UTI, and especially in engaging in dirty toilet practices, they can have the bacteria ascend into the urine tract, the urethra, the bladder, and they get a UTI.
Okay, thank you. But you haven't told me the damage it can cause when you stay for long without treating.
Oh yeah, sorry for that, Tracy. If you stay for long without getting treated for a UTI, then you get complications. And the complications that would be there would be you have your kidneys getting damaged because the infection will ascend up into the kidneys. So when your kidneys get damaged, you get into what we call renal failure or chronic kidney disease. So, and there are multiple effects when your kidneys get damaged because the kidney is one of the useful organs in the body that excretes waste from the system, from the body system. So if they cannot function properly, you accumulate these wastes, and therefore you end up getting other multiple problems in the body. So that is one of the main issues that can happen. The other thing is that if you don't get treated, is that of course you will suffer the consequence of the symptoms. You'll continue to be in pain too long. You'll continue to pass urine too frequently. You'll also continue to have the other symptoms like fever, vomiting, which might affect you, and also you might even die in the long run.
Okay, thank you. So, do you have any additional information you can tell the people who have the UTI or even those who suspect they have?
Anytime one has those symptoms that are suggestive of a UTI, I advise that it's good for you to go to the closest health facility so that you get tested and treated. We also advise that it's good to look at the preventive approaches. One of the preventive approaches I had not mentioned earlier is take plenty of water. Plenty of water helps in terms of just cleaning up your body system, and especially as you pass urine, you will have to be able to ensure that your urine is not very concentrated. It will be in the right dilution concentration. So take a lot of water. Avoid too much sugar. Too much sugar, when it's passed through the urine, sugar is a growing ground for bacteria. So when you take a lot of sugar and the sugar is passed through the urine, the bacteria begin to be attracted because there's sugar there and they can ascend up. So don't take too much sugar because the too much sugar will cause you to have frequent UTIs, and that's why this UTI is more common among diabetic patients. So take a lot of water, don't take too much sugar, do good toilet hygiene practices so that then you prevent yourself from getting UTIs. And if you get tested and treated and it still recurs, we also advise that you can go and request where you get treated from for urine culture. So the urine culture will be able to show specific bacteria that is affecting your urine tract so that you get treated according to that specific bacteria. So that's generally what I could say. And there's also out here a bit of confusion between UTI and STI. So it's always good to be clear about your sexual history as you get attended to, so that in the evaluation, your primary clinician or doctor who is attending to you will be able to delineate clearly as well and send you for the right tests, so that if you could be having an STI but imagining you have a UTI, or you could have a UTI and imagine that you have an STI. So there's always that confusion. Even when you treat patients, they end up feeling that I have a UTI, so this is likely to be an STI. Or I have an STI and they want to downgrade it to a UTI. So it's good to always have that clear conversation with your primary doctor. So I would like to say that UTI is a disease that is treatable, and it's also a disease that is preventable in some ways. And it's also a disease that should not cause any form of shame, because several people, and especially for ladies, in their lifetime, they end up getting a UTI at one moment or the other, because they are more affected than men. And so when you get a UTI, get treated so that you prevent the further complications relating to the same.
Okay, thank you, Dr. Musongo, for sparing time to talk to us. So, dear viewer, thank you for watching this. I hope it is going to be of help to you. And I hope you have heard from him that UTI is treatable and preventable. Until next time, please subscribe, like, comment, and follow. Thank you.
Thank you so much also, Tracy, for having me here.
Welcome.
Yeah.